Good afternoon, everyone, and welcome to or thank you for joining me at our wellness webinar. Today we are going to talk about men's health and the importance of maintaining good health, what to look out for, and when to ask for help. My name is Leanne, and I'm a registered nutritionist for ESS. So, whilst we are focusing on men's health, this is not to say this webinar is just for isn't for everyone. I hope that we will all still be able to take something away from it, either for yourself or a family or a friend. I plan on taking you through the importance of men's health, some key figures to know what to look out for, what may help improve your health, and to think of the wider picture. It's not just about physical health, but the wider health and well-being agenda. And then we'll also concentrate a little bit deeper on the state to support the Men's Health Forum focus this year. So, the facts. Too many men are dying too soon, with 1 in 5 dying before the age of 65, which is shocking in this day and age. 3/4 of premature deaths from heart attack are male, 3/4 of suicides are males, and 43% of men are more likely to die from cancer. Statistics also show that men are 24% less likely to visit a GP or a pharmacy. And this really could be the starting point in trying to reduce the above statistics. So what can we do? Well, it's important to know what is right for you and where you are sitting within the standard health parameters. This can give you an insight as to whether there are things that you need to do to improve your overall health and well-being, and steps that you can take. It's a good idea to check your resting heart rate, count your beats over 4 15-second periods, and then add them the total up, and cross-check with the recommended beats per minute for your age range. Where do you stack up then? If you are in or close to the unfit range, you need to consider if you're doing enough exercise. Aerobic exercise is in the form of walking, running, cycling, etc. And this would help keep a healthy heart. Just like your other muscles, we need to make sure that your heart stays nice and strong. So we need to make it work to keep it strong. And however, if you do have any health conditions, it is really important that you speak to your GP first. Also, checking your waist circumference is a good idea to check your risk of other health complications, such as type 2 diabetes or increasing your risk of heart attack and stroke. And this is regardless to your height. So while standing, if you take a tape measure or a piece of string and measure around the narrowest part of your waist, so in and around your belly button, and then if it's a piece of string, measure that length and see how you stack up. So if you have a waist circumference of over 37 inches, it will increase the risk of some health complications. Now, do you know your blood pressure level? Men are actually more likely to develop heart disease than women. High blood pressure can increase the risk of multiple other heart conditions, commonly known as cardiovascular disease. And this is the general term for conditions affecting the heart or blood vessels. So cardiovascular disease includes all heart and circulatory diseases, including coronary heart disease, angina, heart attack, congenital heart disease, hypertension, stroke, and vascular dementia. There are also many risk factors that can increase your chances of developing CVD, and these include high blood pressure, smoking, consumption of alcohol, high cholesterol levels, having diabetes, and not being active overall. Statistics also show that men do tend to drink more at more hazardous levels, and they do tend to eat more foods that are higher in salt, as well as add more salt to food and consume more red meat and less fruit and vegetables. If you remember one of our first slides, we did state that 3/4 of premature deaths in men are actually from heart disease, and men are more likely to develop heart disease at an earlier age than women. So if we just check our levels then, so just these figures, this systolic pressure, so that's the higher number, is the force at which your heart pumps blood around your body, and the diastolic pressure, so that's the lower number, is the resistance to the blood flow in the blood vessels between your heartbeat when blood is pumped around your heart. Then moving on to cholesterol. So low density lipoproteins, these are cholesterol. This is there are two types of lipids, sorry. So LDL cholesterol deposits cholesterol in the artery wall and blocks part of the artery and increases the risk of a heart attack or stroke. And that is really your bad cholesterol. LDL is bad, think that. Then the HDL, so this moves cholesterol from your blood and into the liver to be broken down. So this is more beneficial and therefore will decrease the risk of atherosclerosis and a heart attack. Normal ranges for total cholesterol are below 5 millimole per litre. For LDL cholesterol, it's 4 millimoles per litre or less. And for HDL cholesterol, you want your figure to be 1 millimole per litre or more. And interestingly, a study found in 2021 that 56% of men had raised cholesterol or raised total cholesterol. So it really is important to be aware of any changes in your body. And to be honest, you guys know you best. So it's important to check regularly. If you have any moles that are changing shape, any unexplained lumps, shortness of breath, pain in chest, swelling or itching, anything that's not normal for you, it really is best to get it checked out. I mean, these may not be anything, but if you do leave it, and it gets worse, it's a lot harder to kind of come back from that, and it's a lot harder to be able to help. So just as soon as you spot anything, just go and see if it is anything or not. Also, do you have any erection problems, men? I think this is quite a taboo subject. It can, it may sort of threaten the sex life, but there's lots of reasons behind this. It could be early warning signs, heart disease, diabetes, high blood pressure, or even a sign of high cholesterol. Or it could be absolutely nothing and maybe just having a rough day. But again, if it's a regular occurrence, it's something that you should really look into and get checked out. So managing your weight is one of the key factors in helping to maintain your health. Being aware of what you eat and increasing your physical activity are both ways to successfully manage your weight. Moving more is a good way to help progress towards improving your health. And this really, it can be anything from sort of walking, so getting off a bus stop early, walking when you have the opportunity rather than hopping in the car, doing some gardening, some housework, just moving more in general. It is also really important to swap healthy snacks for healthy ones. So again, you can use the front of pack labeling to check, what colors they are. If it's all red, kind of best to avoid or take a little bit. You don't need to eat the full portion. Aiming to eat fruits as a snack rather than chocolate and confectionery. All these will help. So eating lots of vegetables or maintaining a healthy diet, eating lots of vegetables, is really important. It's good to try and aim for 1 of your 5 a day. Fruits, whole grains, some lean proteins and healthy fats will help your body to work at its best. And you should really aim to reduce foods and drinks that are high fat, salt and sugar. Some fats are bad for your health, such as saturated fat, and eating many foods that are high in saturated fat, such as the fat on meats, cheeses, butters, cakes, coconut oil, etc., they really can contribute to increasing your cholesterol levels. Swapping foods high in saturated fat for foods that contain unsaturated fat, such as olive oil, vegetable oils and spreads, nuts, seeds, and oily fish will also help. If you have high blood pressure, cutting down on salt is a really good idea. That's a really good start. And eating too much salt raises your blood pressure over time. So if you're, one of these ones that will add salt to food, I know, obviously that's a taste preference. So weaning yourself off, reducing it little by little, and then, being able to stop really will help. And then sugar, so if you eat too much sugar, that obviously will lead to weight gain because it will become excess calories. Um, it will also increase your risk of heart and circulatory diseases. So it really is important to track your sugar intake. And again, like simple changes like if you add sugar to tea and coffee, weaning yourself off that. If you opt for a confectionery like biscuit or sweet, you're kind of after dinner, you reduce the portion size to start with, and then eventually you just won't fancy it. Um, a healthy diet is just, not what you eat. Also, kind of thinking about the portion sizes to help control, kind of how many calories you're actually consuming. So quick and easy way to monitor this is, a handful for you usually is around one portion for you as an individual. Cut down on alcohol. So alcohol actually can provide you with a lot of excess calories, and there's no other nutritional benefit, So it's cutting down or cutting out is really the way to go. Obviously, not drinking alcohol is the healthiest way, but if you do fancy a drink from time to time, there are ways in which you can reduce your alcohol intake and reduce the calories. So, for example, instead of having doubles, so double vodka and Coke, opt for singles, opt for a half pint. Drink water in between each round, opting for small glasses of wine, or, there's also an increasing range of alcohol-free options out there. So, we may want to try one of them. And let's not forget about our mental health. So, how are you feeling? How are you really feeling? It's very easy for people to ask, how you're feeling, but, asking twice is always a good thing, because often people just say, oh, I'm good, but is that just to kind of brush them off because they're not feeling good? Are they actually feeling okay? Asking twice just reassures that you actually genuinely mean it. Men's mental health is really important. Causes of death, not just physical, but it can be due to mental health too, with 3/4 of suicides actually being men. The mental health problem is prevalent in men, but unfortunately, they're less likely to talk out due to old traditions, stereotypes, etc. And 13.5% of men in the UK have a common mental health problem, such as depression and anxiety, panic disorder, or OCD. For anyone who may be suffering from poor mental health, the Can Do, which we'll talk about in the next slide, the Can Do challenge can actually help. And that was a theme for the Men's Health Week in 2021. And the challenge really is trying to embrace 5 ways to well-being. So here we go. Can Do challenge. So first one is connect, so contact others, reach out, drop someone a message to let them know, you're there, that, there's good evidence suggests that being close to and valued by others boosts your overall well-being. Being there and helping someone, even when you also need help, can help too. The next one is be active. So get out into nature if you can, even for a short period of time, and get active. Being active releases those happy hormones, endorphins, and can make you feel better after. The next step is notice. So be present, notice changes around you, put your phone down, shut your laptop screen, and engage in what is actually going on around you. Practicing mindfulness and breath is a great way to achieve this, and just being in the present moment. Then discover. So discover, continuously seek opportunities to learn and go somewhere new. Be adventurous, and this will help develop yourself. This may also help protect against diseases such as dementia. And then finally, offer. Give something to others, your time, a gift, a note, words can speak volumes. This will not only make them feel better, but, you never know, what others maybe are suffering from and not kind of opening up. And it may sort of be the gesture itself may kind of help them open up, as well as it will make you feel good too. And then it's good to talk, and that's something that perhaps men don't maybe do enough. I know there's been lots in the media about men's health, mental health, and men are starting to talk more, but it's something that population group does still need to really work on, particularly the older generations. So start a conversation, talk about your feelings, keep in touch with people, ask for help. Be mankind, be kinder to yourself. Stay active, eat well, drink sensibly, and then support other men. Look out for your own kind. If you talk and open up, it's more likely that your friend or your colleague will open up too. It's okay to cry, get teary, or to say, I need a moment, take a step back, and even offering some affection and giving, someone a pat in the back, it's like, "Are you all right?" or a hug, that really can speak volumes. And listen, we're we're all sometimes caught up in our own lives, but if you ask you, "Are you okay?" Be prepared to listen. You don't have to give any advice. Just sometimes being there and listening to someone, and helping them to open up and getting them to sort of let it all out can really help too. So, as I said at the start of this presentation, the Men's Health Forum this year is promoting awareness of the prostate by their book, P is for Prostate. It is a campaign. You can go and search for it online, and they actually have a book. So let's look at the prostate then. The prostate is a gland. It's usually the size and shape of a walnut, and it grows bigger as you get older. Sits underneath the bladder and surrounds the urethra, sorry, which is the tube that carries urine. So it helps you go down, it kind of surrounds it enables you to go to the toilet basically. The prostate's main job is to help make semen, the fluid that carries sperm. So trans women, non-binary people who are assigned male at birth all have a prostate, and some intersex people may also have a prostate too. So there are certain things that can happen to the prostate, and so it's good to kind of just check in and make sure that everything is okay. Men can experience an enlarged prostate that may result in changes in the toilet behaviour, and can usually happen. This can usually happen over the age of 50, so it is perfectly normal. Mastitis, so this is a name given to a set of symptoms which are thought to be caused due to an infection of the prostate. And again, this is very common and usually occurs in younger men, so between the ages of 30 to 50. And symptoms include discomfort or pain in the testicles, abdominal pain, groin, inner thighs, or back pain. And you may need to go to the toilet more frequently, and there may be a little bit of pain when going to the toilet. And it may feel like you're sitting on something such as like a golf ball or something. If you feel anything like that, just go to the doctor, and I'm sure they'll be able to give something that will help. And it's also really good to get everything checked out. Both of these are often nothing to be concerned about, but as I said, it really is important to get it checked out. And then prostate cancer. So this is more serious, and this is when the cells of the prostate grow uncontrollably. And unfortunately, men who are in the early stages of prostate cancer actually usually have no symptoms, which is why it's quite hard to detect. Within the UK, prostate cancer is one of the most common cancer in men, with more than 47,000 men diagnosed with prostate cancer every year. So that's actually 129 men per day. So what can we do then? Screening for detection of any abnormalities is essential. The PSA test, so that's prostate-specific antigen, is what PSA is, and that's a protein produced by both normal and malignant cells of the prostate gland. The PSA protein is present in small amounts in the blood of men with healthy prostate, but higher levels can indicate prostate issues. Then we also have the digital rectal exam. So this is a physical exam and it's commonly used to check for abnormalities in the prostate gland, such as enlargement, lumps, or other irregular happenings that could indicate prostate cancer or other conditions such as benign prostate hyperplasia. And then we also have a biopsy. So a biopsy is a medical procedure in which a small sample of tissue is removed from the body for examination under a microscope. And this procedure is essential for diagnosing various conditions, including cancers, infections, and inflammatory diseases. And then treatment. So it is important to make regular checks at home. And if you notice any abnormalities, get it checked out straight away. So active surveillance is key. Other treatment may be a prostatectomy, so that's removal of the prostate, radiation therapy, hormonal therapy, or chemotherapy. And again, if there are any abnormalities detected, your healthcare professional will advise you on the best route to take. But please monitor and get checked if there's any abnormalities. So if we just recap quickly, in general, it's important to maintain overall good health by having a healthy, balanced diet, exercising regularly, and being aware of your mental health and talking about your mental health. If you're stressed at work or there's things going on at home, kind of being able to talk to someone helps you unleash those feelings and deal with them, and perhaps getting some support, And then be aware of changes and seek help when needed. You know you best. So if there's something you feel isn't quite right, no question is a silly question. Go to the GP, ask, because if you don't ask, you won't know. It'll play on your mind. It may make you feel a bit more stressed, so it's all kind of interconnected. So be aware of you, what changes happen to you, and get everything checked out straight away. So that is the end of our wellness webinar this month. I just want to remind you of our Ask Your Nutrition and Wellbeing Specialist email address. Please do, if you have any questions, contact us at ess.wellness@compass-group.co.uk. You can either ask a personal question, and if we can't answer it, we will point you in the right direction, but you can also book us in for some educational talks, health events, one-on-one sessions, virtual webinars, etc. So please do get in touch. We really are here to support. We also have our 12-month wellbeing calendar, so look out for our wellbeing boards on all our sites, and this information does update regularly, or well, every month. And then we have our seasonal magazine. So, the latest one is currently out. We are working on our summer special edition. And again, it's linked to UK and worldwide health initiatives, all linked to our wellness commitment. So healthier mind, body, food, and world, as well as adding some personal accounts that may actually give you some tips, advice, or spark a thought. So please do sign up through our wellness email address as well. And then finally, if you want to check out any of our other webinars, please do visit our We Are ESS YouTube channel, and feel free to forward on as well. Thank you for joining.